Good afternoon, everyone. Thank you for coming today in Dudley. This is my first experience of the city chambers. It's very nice. Before we start, I'd like to say don't press the speak button until you've raised your hand and I ask you to speak. This is the way the system works. Okay, thank you. Shall we start recording? Yeah. This meeting will be webcast for live or subsequent broadcast, and members of the press public may record the meeting. The whole of the meeting will be filmed, except where there are confidential or exempt items. Apologies received. I've got Councillor Beanie, Councillor Saida Kutum, Councillor Sabina Adita, Councillor Tersem Singh, Councillor Perry. Is there anybody else that's been notified?
And also Councillor Odin, who was named substitute in Sandwell.
Okay. Declarations of interest. Members are reminded they must declare all relevant pecuniary and other registrable interest arising from any business to be discussed at this meeting. Are there any declarations? Okay, Councillor Moore.
Thank you, Chair. I don't think it's relevant for today's meeting, but just in case, I'm a trustee of Birmingham LGBT, which provides a domestic abuse service.
Okay, thank you very much for that. I've not seen any of the hands up. Okay, so we go to the minutes that were held on the 30th of November. There's two sets of minutes. There's the 13th of November and the 18th of December. We'll go through it and see is it confirmed as a correct record. So let's go through the first set, 13th of November. Can we confirm there's a correct record? Yeah. I'm not seeing any objections, so we'll take it as accepted. Any matters arising on those? No? Okay, thank you. We'll move on to the second lot of minutes, which was the 18th of December. To accept those as a correct record? Yeah, okay, thank you. Any matters arising? No. Okay, thank you very much for that. We go on to Agenda 5, the Police and Crime Panel Action Tracker. We have two outstanding actions, both relate to the PCC's oversight of the work to address survey findings relating to culture, morale and well-being. Could you indicate when this information will be provided? There's some couple of outstanding reports that we've requested. They haven't yet come to the panel. Can we expect them? No?
Thank you, Chair. When do you want them by? Sorry, I'm catching up. With which items are we talking about that are outstanding?
Okay. There was the first one that was going back to last January 23. There's a report about actions to address the findings from the recent West Midlands Police Employee Survey relating to staff morale, engagement and culture. That was going to be made available to the 13th of November meeting, but we didn't receive that then. That would be circulated members, so I was just wondering if that could be circulated.
Yes, of course, Chair. My apologies. I thought it had been. I'll pick that up as an action.
Okay, thank you. And then the other item is the request to expand the Fairness and Belonging Plan report to highlight the actions taken to address the West Midlands Police staff survey findings relating to police community support officers.
Again, apologies, Chair. We have that data. I'll make sure it's shared with the panel.
Okay, thank you. We look forward to receiving that soon. Going to 6, public question time. We have not received any question from the public, so we can move on to the next item, which is the police and crime plan commitment tackling drugs. When we reviewed the Commissioner's annual report, we asked for more information, the police and crime plan commitments relating to tackling drugs. We were also interested to understand more about the statement in the annual report that it had been estimated that half of all homicides and acquisitive crimes are drug-related. I will just let you know, I'll allow 20 minutes for presentation to leave time for members to ask questions. Over to you, Simon Foster. Okay.
Thank you very much, Chair, and good afternoon and Happy New Year to all members of the Police and Crime Panel and the support team. It's a pleasure to see you all in 2024. I'm joined by Jodie Clark, the Regional Drug Strategy Lead, and Esther Whittock, Policy Officer, both of whom are members of my team within the Office of the Police and Crime Commissioner. And I trust that you've all had an opportunity to have a look at the report that was circulated with the agenda. And before I pass over to Jodie and Esther to take us through the report, I have a brief introduction. When considering the action that's required to prevent, tackle and reduce drug-related, acquisitive and violent crime and criminal exploitation, there's no better illustration of the importance of the need for prevention, partnership and rehabilitation. Local authorities became responsible for funding and commissioning drug and alcohol services in April 2013, whilst facing a 37% reduction in central government funding between 2010-11 and 2015-16. Net expenditure on adult drug and alcohol services decreased by 19% in real terms between 2014-15 and 2018-19. Over £100 million less was being spent per year on drug and alcohol addiction services between 2016-17 and 2019-20. That increased the likelihood of alcohol and drug-related crime and contributed to a continuing market and customer base for organised drug-related crime gangs. Fortunately, the government began to realise, albeit belatedly, that its approach was actually contributing to drug-related, acquisitive and violent crime and criminal exploitation, and was therefore counterproductive and incompatible with an intention to prevent, tackle and reduce drug-related crime and criminal exploitation. And it commissioned Dame Carol Black to conduct a review. That was published in 2 parts. Part 1 on the 27th of February 2020 and Part 2 on the 8th of July 2021. On the 6th of December 2021, the government published its Drug Strategy from Harm to Hope, a 10-year plan to cut crime and save lives by reducing the supply and demand for drugs and delivering a high-quality treatment and recovery system. As the plan acknowledged in 2021, amongst many other matters, the financial cost of drug misuse is absolutely staggering. It currently costs society almost £20 billion a year, something like £350 for every man, woman and child in England. The human toll is incalculably large, measured not in pounds lost, but in lives shattered, including the almost 3,000 people who lose their lives to illicit drugs each year. There are more than 300,000 heroin and crack addicts in England who, between them, are responsible for nearly half of all burglaries, robberies and other acquisitive crime. And that if we can turn around the lives of addicts, the communities in which they will live will experience lower crime, lower disorder and less violence. With disarming honesty, it acknowledged the need to rebuild what had been dismantled, including local authority commissioned substance misuse services, improving quality, capacity and outcomes, and the need to rebuild the professional workforce. Following publication of From Harm to Hope, we convened a regional roundtable event on the 16th of February 2022. We met with Dame Carol Black on the 3rd of March 2022, wrote a regional recommendations report on the 21st of April 2022, and established the West Midlands Combating Drugs and Alcohol Partnership in August 2022. I chair the West Midlands Combating Drugs and Alcohol Partnership, and I'm the designated senior responsible owner, otherwise referred to by Kit Malthouse, the then Minister for Policing, as our local team captains, which carries with it the responsibility to represent and account for local delivery and performance to central government, and also to act as a key local point of contact for central government and the National Combating Drugs Outcomes Framework, providing a route to track progress on a local and national level. I'm now going to pass over to Jodie and Esther to present the report. Thank you.
So I'm going to talk through the Police and Crime Plan and the commitments made there to tackling drugs, and looking at how the Police and Crime Commissioner and his office has made progress against these. So the first commitment is to increase the use of out-of-court disposals for low-level drug offences, such as those given via the Divert programme. So over the Police and Crime Commissioner's time in office, there has been an increase in the use of out-of-court disposals for low-level drug offences, with 40% of drug possession resulting in an out-of-court disposal in 2022-23. This is an increase from 32% in 2019 and 2020. Now, the Divert programme, also known as the Pre-Arrest Diversion Scheme, which has been delivered by Cranston and managed by West Midlands Police and commissioned by the OPCC since 2020, is for anyone found in simple possession of drugs. So it's not for people who are found in possession with intent to supply, but for those with simple possession. They can be referred into the scheme numerous times as long as they engage each time. Now, it's a voluntary referral scheme, it doesn't lead to a criminal record, and it's an education programme that aims to divert people and offenders away from court and from longer-term drug use into the most appropriate intervention. Now, Birmingham has the highest number of referrals into Divert, which given its size and population isn't surprising, and Cranston have achieved a 72% retention rate from initial intervention to group work. Now, another commitment in the Police and Crime Plan is to monitor disproportionality in the use of diversion, and Divert reduces disproportionality. Before Divert, 40.5% of Afro-Caribbean offenders were charged for possession versus 35% of the average, and this dropped to 11.4% after Divert versus the 11.3% average. So there's a reduction overall and also more in line with the average population. Another commitment is to increase the number of people in custody being referred into drug treatment where a need is identified. So in 2022-23, 1,418 people in custody were referred into drug treatment, an increase from 1,087 in 2020. So the Cranston Arrest Referral Service, also known as CARS, so I will be referring to it as CARS throughout the presentation, which is commissioned by the Police and Crime Commissioner, is the main service whereby people in custody might be referred into drug treatment. And they assess individuals in all 6 of the main custody blocks. Now, the main aims of the service are to engage offenders in custody following an arrest and provide an opportunity to break the cycle of drugs and/or alcohol. Now, they complete both required assessments and voluntary assessments. So required assessments are for those people who have committed a trigger offence, which results in a mandatory drug test on arrest. And if they then have a positive drug test result, they'll have a required assessment. And then a voluntary assessment is done by Cranston Arrest Referral workers, sweeping the cells, talking to people, and this will then lead to a voluntary assessment. Following either required or voluntary, they will then be referred on to treatment in their local area, and the provider of that treatment will depend on the local authority. Cranston Arrest Referral workers also currently work with the courts and probation in supporting community sentence treatment requirements process. They complete alcohol treatment requirements suitability assessments and drug rehabilitation requirements suitability assessments in custody, and also currently when requested by the courts. Now, the data is not yet available about whether there has been an increase in the number of community sentence treatment requirements made. This is still being evaluated, and therefore the OPCC will continue to work with probation on this, and therefore should be able to give you numbers later in the year. Another commitment is drug safety testing in the nighttime economy. Now, as mentioned in the report, this is an area which is ongoing due to Home Office licence requirements. We are continuing to have conversations with the Loop, who are providers of drug safety testing services, and a range of local partners to explore the potential of providing drug checking services in the Birmingham nighttime economy. Now, this would help engage with people who have already decided to take drugs and be an opportunity to provide harm reduction and drug education, so help them make more informed choices in the future. So this would be an opportunity to engage with people who take drugs. Another commitment is the drug early warnings programs and monitoring the number of drug-related deaths in the West Midlands and act accordingly where there are significant increases. Now, the number of drug-related deaths is monitored at the Strategic Policing and Crime Board. So the numbers that I've put in the report are from the November Strategic Policing and Crime Board, and it was reported that there were 442 drug-related deaths in the West Midlands between 2019 and 2021. Now, in late December, I do have some more recent updates for you. So in late December, ONS published drug-related deaths for 2022. So for the West Midlands County, the number of drug-related deaths due to drug misuse were 163. And the number of deaths related to drug poisoning in the West Midlands was 207. And when I say the West Midlands, I mean in terms of the West Midlands Police region. Work on drug early warning system has progressed this year, and a draft protocol will now be raised with West Midlands Police for sign-off. The draft protocol has been developed to ensure the safe transport and testing of substances suspected of causing harm, so that public health harm reduction messages can be passed down to at-risk populations. Following OPMABL, which Jodie will talk to you about later, the Office of the Police and Crime Commissioner will also be conducting a local drug information system, so an LDIS audit of the 7 local authorities in the West Midlands, so that the West Midlands Combating Drug and Alcohol Partnership can better understand the current situation and also the progress that the local authorities have made in establishing and trialling their local drug information systems. So each local authority having an established local drug information system is important, so they can share and assess drug information on new, contaminated or powerful drugs and be able to issue drug alerts when necessary and warnings sent to the right people. Another of the commitments was aiming to engage people who are not well served by current provision. So firstly, looking at provision for women, the Police and Crime Commissioner, in partnership with the Jabs Foundation, co-commissioned research to expand the evidence base on the needs of women who use drugs and alcohol and the way that those needs are currently being met. The research found that many of the drug and alcohol community treatment services, unfortunately, were not able to fully meet women's needs. The Police and Crime Commissioner will continue to highlight the importance of meeting the needs of women who need to access treatment, and will endorse the recommendations from the research so they are considered by local authorities when commissioning their drug and alcohol treatment services. And these are conversations that we are continuing to have with local authorities and their treatment providers. Last year, the West Midlands Combating Drug and Alcohol Partnership Lived Experience subgroup was set up. It continues to meet and discuss how we can feed lived experience voice into the Combating Drug and Alcohol Partnership and build the relationship with local lived experience leads and local authority groups. The aim of the subgroup is to engage with lived experience voice, to learn from experts through experience, to understand their needs and where they're not being met, and to ensure that their voice is fed into the Combating Drug and Alcohol Partnership delivery plan. Another of the commitments was to increase disruption activity by West Midlands Police as part of proactive drug supply investigations. Now, in 2022-23, there was an increase in the total disruptions in comparison to previous years, with a big increase in county lines disruptions. So there were, in total, 2,641 disruptions with greater focus on county lines, as this is a focus for a lot of the recent drug supply activity. In 2021-22, there were a total of 2,552, and 2020-21, 984. The report outlines the activity of West Midlands Police to crack down on county lines gangs and drug supply, such as the county lines financial investigators now generating income through seizure and confiscation of criminal assets. Q2, cash seizures alone being over £250,000. Home Office line closure targets have increased during 2023-24 to 240, but as of November, the County Lines Task Force had secured 70% of, or nearly 70% of Home Office targets. The last commitment that I'm going to talk about is monitoring the number of drug trafficking offences recorded by West Midlands Police and reports which are flagged as county lines related. These again are monitored at the Strategic Policing and Crime Board. Headline figures are that in 2022-23, 2,174 drug trafficking offences were recorded by West Midlands Police, and in January to December 2022, 122 reports by the National Referral Mechanism are flagged as county lines related. Now, I'm going to move on to talk about drug-related homicide data and drug-related acquisitive crime data. Now, as the report mentions, the government document From Harm to Hope, published in December 2021, states that nearly half of all burglaries, robberies, and other acquisitive crime, and half of all homicides are drugs-related. The Home Office Homicide Index shows the number of offences currently recorded as homicide that have involved drug users or dealers or have been related to drugs in any way in England and Wales for the years ending March 2012 to March 2022. So here, an offence is drug-related if any of the following variables apply. So it is quite a broad definition. So the victim is an illegal drug user, the victim is a legal drug dealer, the suspect is an illegal drug user, the suspect is an illegal drug dealer, the victim has taken a drug, the suspect has taken a drug, the suspect had a motive to obtain drugs, the suspect had a motive to steal drug proceeds, or is drugs related. So I'll be coming back to that definition in a second. The Homicide Index shows that since April 2019, the percentage of homicides which were drug-related nationally has been 50% or above, 53% in April 2020 and 52% April 2021. Research published by the Home Office in 2013 showed that the proportion of acquisitive crime, so they are including vehicle theft, burglary, robbery, theft from a person, theft from a shop, other theft, but excluding fraud, that is drug-related. It ranges from 44 to 48%. Now, the reason why there's that range is because it's dependent on different definitions of drug users. So 44% when defining drug user as use of heroin or crack cocaine is more than twice a week, and this increases to 48% when defining drug user as use of heroin or crack cocaine or cocaine powder at least once a week. Now, in our report, we cited local figures of drug-related homicide and drug-related acquisitive crime that we currently have available. And these stats are showing as lower than 50% of homicides and acquisitive crime. Now, we took a certain approach to collecting and identifying this data. So one of our data analysts used the drug-related keyword filter on the West Midlands Police crime data system. However, it isn't clear how the West Midlands Police database defines drug-related to filter the data. And in comparison, as said previously, the Home Office has a very extensive definition of drug-related in the Homicide Index. There can also be differences as seen from the Home Office acquisitive crime data in defining drug user, so there can be variations in data depending on this definition. So it is difficult to compare local and national data. Also, the Home Office Homicide Index doesn't break down the drug-related homicide data by force area, so this data only gives a national picture rather than percentages of drug-related homicides per region, again making it difficult to compare as not necessarily comparing like for like. The acquisitive crime data, they got their percentages of drug-related acquisitive crime using two self-reported offending surveys, the Offending Crime and Justice Survey and the Arrestee Survey. So the data was collected in a different way to the way that we collected our data, so again, it is difficult to compare. Now, having said that, we have no reason to presume the West Midlands is any different from the national picture, so it is likely that the numbers of drug-related homicides and acquisitive crime are higher than the West Midlands Police database system currently shows, and likely the local data presented in the report is not necessarily reflective of what the actual picture is. The Office of the Police and Crime Commissioner commissions and is enhancing the arrest referral service to continue to identify those whose crimes are linked to drugs, especially those who aren't known. So that's really key, finding those people who aren't known yet, and takes meaningful action to help those individuals and resultantly reduce drug-related crime. So CARS, the Arrest Referral Service, addresses and aims to reduce drug-related acquisitive crime by completing those required assessments for those who have had a positive drug test. Now, they'll have had that due to a result of being arrested for a trigger offence, and many of the trigger offences are acquisitive crimes. This will then help them get treatment. Also, Offending to Recovery, formerly known as Offender to Rehab, helps to address drug-related retail crime by providing a pathway for offenders of acquisitive crime addicted to Class A drugs to get treatment. Now, Offending to Recovery, it started in Birmingham and it's now expanding to other parts of the West Midlands. And in 2023, the majority of individuals entered residential rehab or referred into other treatment. The programme aims to be stabilised and expanded through the Supplemental Substance Misuse Treatment and Recovery Grant funding, which is from local authorities. So this grant comes from the Home Office and it's given directly to them. Now, additionally, the Police and Crime Commissioner commissions Mentoring West Midlands to deliver a service in Coventry that provides a specialist mentoring support to a cohort, many of whom are acquisitive crime offenders and many of whom have substance use needs. And furthermore, harm reduction and treatment is a key approach to tackling drugs and a key commitment of the Commissioner. So early interventions are key to stop crimes further down the line, such as homicide or acquisitive crime. I'll pass over to you.
Thank you very much. Hi, everyone. So I'm going to talk about some of the broader... I shall rattle through. Yeah, I will. Yes, absolutely. So I'll broadly touch on some of the national issues that are happening and also some of the local developments happened over recent months. But just to give you context, the National Drug Strategy was published in December 2021. This was, as the Commissioner and Esther have both mentioned, a follow-on to Dame Carol Black's review of drugs that took place in 2020 to 2021. It's probably the most extensive, her review was the most extensive look at drugs anywhere in the world. It really did unpick the impact drugs have on our communities and also the response we take to it. The two things that really came out of her review was, one is that even sufficiently resourced enforcement activity to stop the supply of drugs is unlikely to be successful. And two, that in order to really make a difference on the impact drugs have on our communities, it's through reducing demand for drugs that's going to have the biggest impact. And for those that are actively using drugs currently, it's by getting them into treatment. But her review did highlight that the system of treatment and recovery that currently exists was broken and in urgent need of repair, was the language she used. It was quite, I guess, explosive, her review. I think it was an independent review, but the government accepted it entirely and all of the recommendations. And the drug strategy is a direct result of the work that Dame Carol put into that. A lot of money goes alongside the drug strategy. There's just shy, I think, of £900 million that's going to be invested by the end of next year. So there's a significant increase following, as the Commissioner mentioned, funding cuts that happened since 2013. It's broadly broken into three areas. One is how we can break the county lines drug dealing model through enforcement activity, how we can rebuild the treatment system to once again be a world-class and world-recognised system of treatment and recovery, and also to how we can increase prevention activity to prevent people using drugs in the first place. At the moment, we're 2 years into the drug strategy funding. Next, as of March, will be the third year of funding coming into it. I think it's fair to say that the enforcement side has had the most comprehensive and consolidated approach to the activity that's being required of law enforcement agencies. There's definitely a sense of mission for everyone who's involved there. And I think that's because of the close working with the Home Office, the NCA, the MPCC and police forces. The rebuilding the treatment system element, which is where the bulk of money has gone into local authorities to help with their commissioning activities around drug treatment. We're yet to see some of the impact that was wanted, especially in regards to getting more people into treatment, reducing deaths, and getting more people who are coming out of prison to engage with drug treatment when they come out. I think we're going to see there's a lot of ministerial interest in this, especially for numbers in treatment. That's the primary motive, primary metric that local authorities are being held to account through OHID, and it's the Combat and Drug Partnerships' responsibility to help secure that. The Combat and Drug Partnerships were a huge development that the drug strategy introduced. Each area was required to establish one of these. And in the West Midlands, we have one that covers the whole of the police force. Simon is the SRO that oversees it. And in each area, each local authority has their own local drugs partnership that helps drive their commissioning activity and the work that the local authorities are responsible for funding. And then collectively, we come together as the Combat and Drug and Alcohol Partnership, CDAP, to oversee that work and look at areas where greater partnership working can have an impact. Part of establishing the CDPs was publishing a needs assessment. When they came in, which was August 2022, we were given a very short period of time to do a lot of work. One was to do a needs assessment, and two was to do a delivery plan, all by the end of December. Usually, from a public health perspective, a needs assessment would take between 6 months to 12 months to properly complete that process. But we were given quite a short period of time in order to do them. The needs assessments, as we've circulated in the report, these are the highlights really that came out of it. drug use isn't equal across the patch. There is variation, especially in heroin and crack use, across different local authorities. Birmingham, Walsall and Wolverhampton are probably the ones with the highest prevalence of opiate and crack use. And it was highlighted that drug offences in the area are and have historically been lower than other areas. Drug-related deaths on average across the area are in line with the national average. However, in Birmingham, Walsall and Wolverhampton, they have deaths above the national average, particularly in Birmingham, which has particularly high numbers of death. The enforcement and the county lines aspect for this area is particularly interesting because the West Midlands is one of the top exporters of drugs within the UK. So county lines coming out of Birmingham in the West Midlands have a presence from the Scottish Highlands all the way down to Cornwall, and those lines being coordinated locally and then with people running drugs into areas. And some areas now are having access to heroin and crack, who maybe, or especially crack cocaine, who didn't regularly have access to the drug previously. So the county lines model has been very successful in getting drugs into developing new markets and new income for organised crime groups. Simon already touched on the issue about the decline in number of people accessing services between 2010 and 2019, and drugs treatment services really did see a decline in numbers of people accessing it, primarily because they didn't have the same number of staff as they once did. And this is one of the things that the government has recognised in the 900 million, well, it's just shy of 600 million going directly into drug treatment services, is primarily to open the doors up again and engage more people, because if we get people into treatment, their drug use, whilst it might not stop overnight, it will decline and the reliance on the illicit market will go, meaning that there's not profits going into organised crime groups. Once the need assessment was published, we had a requirement to publish a delivery plan within the combat and drug partnerships. Because we're covering multiple local authorities, there's a slightly different approach to combat and drug partnerships that just cover one single area. Each local partnership has their own drug partnership plan. That's driven by their commissioning activity, and they are all working with local partners to develop local activity that will help move towards the outcomes sought by the National Drug Strategy. The CDAP's delivery plan looks at activity that spans a wider geography and brings people together for more coordinated working. Really broken down into deep dive subgroups and task and finish groups. And there's a number of them listed there that aiming to bring people together. So Esther, for instance, has been doing a task and finish group recently, a deep dive, isn't it, on nitrous oxide and the impact that the recent changes to law are going to have. There's also a lived experience subgroup that's bringing local authorities together to see how we can tap into people with lived experience of both treatment and recovery, and how that can be a strong voice in the developments that take place going forwards. To touch on naloxone, we were asked to give an update on where we are with naloxone. So as you may be aware, West Midlands Police paused officer carriage of naloxone over the summer. So naloxone, for people who don't know, is a drug that can be given when people are overdosing to reverse the effects of opiate overdoses. So if people have taken heroin and they're overdosing, naloxone can bring people around, and it's a drug that can be given without a prescription through drug treatment services to anybody for purposes of saving a life. Thousands of doses are given out over the last few years, and hundreds of different organisations all carry naloxone for if they in a situation where they witness an opiate overdose. So hostels, outreach workers. There was a multinational came forward because of where they work. They often see people in distress. They get asked to be trained on it. So the pause carriage whilst the Chief Constable has a review carried out, which is underway and is happening. It came about because of some concerns that were raised at National Police Chiefs Council, as listed up there, and Superintendent Drug Lead for the force is currently carrying out a review about whether it's safe and proper to reintroduce naloxone, and we're waiting the outcome of that. Positive conversations are happening about it. We're hopeful that we will be able to return to having officers carrying naloxone, and the Commissioner is in regular conversation with the Chief Constable about that. And then lastly was OPMABL. So OpMabel was a multi-agency response stepped up by the force following a particular increase in drug deaths over the summer. In a very short period of time, a number of deaths were recognised to have taken place in houses of multiple occupancy, and the force led bringing together partnerships to bringing together partners to look at how this can be responded to. It became apparent quickly that this was due to nitazines, which is a form of synthetic opioids that have been added to heroin in order to potentiate the effects. Probably due to the fact that in Afghanistan, the Taliban have banned opium production, and now the remaining stock is being controlled. Prices are going up, and in order to eke it out further, nitazines can be added to bulk out heroin. 45 deaths occurred that we're aware of, and at the time 17 had been confirmed as having synthetic opioids present in the toxicology reports. We're still awaiting results for all of them. Some came back as not having any nitazines. A lessons learned document is being developed, which we're waiting to see. Unfortunately, for a reason that they took, the Local Resilience Forum decided that the OPCC shouldn't be present at the meeting, the strategic partnership meeting. So we weren't actually there to influence or report back, but we are aware that there's a lessons learned document that's due to be published imminently, we think, and we're hoping to discuss it, see that meeting on Wednesday, where the Director of Public Health will be presenting it and discussing how we can prevent a similar outbreak from happening again. I believe that was the last slide.
Okay. Thank you very much for that detail, Simon, Esther and Jodie. I'm looking around. One of my questions is, you know, when you mentioned Birmingham, Walsall and Wolverhampton experienced is a top exporter. The West Midlands is a top exporter of drugs within the UK. Just trying to understand, are the drugs being generated in the West Midlands and then being exported on cross-country lines? How is,
Most of it will relate to heroin and crack use, so it will be imported from abroad.
Okay.
But it is so, the West Midlands, Merseyside and London are the three largest exporters of county lines. So it's local drug gangs who have identified that actually moving drugs around through county lines methodology is quite a risk-free way of making money. So they can get young people to take drugs from Birmingham to Dundee, sell drugs up there, all coordinated through burner phones, so there's no link back to the Birmingham-based gang, and it's just become an avenue for drug gangs to generate profit.
Okay.
So yeah, the West Midlands is highlighted and is recognised by the NCA as being one of the top three areas for doing so.
Okay, and that sort of do on cross-country lines, but about those drugs coming into the West Midlands, is there a way of tracking that back? And
well, we know exactly where they come from. So the heroin will come from Afghanistan, through Pakistan, and through. There's a number of routes it will come through, but it's imported. That's the drug smuggling and trafficking element of the drug market. But once it hits Birmingham, it's then in the hands of drug dealers to then supply it to people who are going to use it ultimately. And there's just chains of people involved in that supply. But it's a huge market. I mean, the West Midlands is probably something in the region of 600 kilograms of heroin demanded every year. So the profits are well over £500 million worth of profits available just for heroin, similar for crack as well. So it's £1 billion industry, I should say.
okay. Okay, thank you, Jode. Over to Sam. Okay.
Thank you, Chair, and can I thank the three for their very clear and comprehensive presentations. Can I ask you a question about out-of-court disposals, please? Many people who walk through our towns and our cities throughout this region smell skunk. And in some ways, skunk has become the smell, certainly of Birmingham. You smell it throughout the city centre. Now, with out-of-court disposals for cannabis and Class A drugs, what do you say to those people who are sceptical about people being dealt with in that way, rather than going through a court and see it as a green light for further drug use and further drug taking? So a lot of people say we're not being tough enough at the bottom of the chain. We're being tough at the top, but we're not being tough on the bottom. And they see it as a soft way for people who are caught with small amounts of drugs. And what do you say to that? It's not a view I necessarily agree with, but it's a view that's often expressed, certainly in ward forums, and people, just ordinary people, saying, well, they're being caught with drugs. Why aren't they being punished appropriately? So perhaps if you can answer that. Thank you.
So a lot of the evidence is, and it's counterintuitive and people don't like it, is that the criminal justice route for preventing drug use does not work. And in fact, it can sometimes lead to unintended consequences, that people's drug use becomes entrenched and actually escalates, because criminal record, we're talking about young people mainly. It's mainly 16 to 24-year-olds. And a criminal record has life-changing consequences. And yes, we can have a consequence about, yes, that's their fault, and they should, but it has life-changing consequences for society as well. So we know that the criminal justice route does not happen as a drug prevention intervention. What we do know works is education. And what an out-of-court disposal gives is an opportunity for people to be diverted into drug education and actually learn about the consequences and risks of the activities that they're undertaking, and really give people that ability to make more informed choices. It doesn't fit a narrative for being tough on drugs. It does fit a narrative of being effective on drugs and actually giving people the skills, knowledge, and tools which to make better informed choices. So I mean, that's fundamentally why we want to do this. It's just about wanting to engage people as early as possible. And it's not necessarily that everyone's on a journey to dependence, but everyone that does get to dependence started somewhere. And if we can engage people as early as possible, and the criminal justice system is a great way of doing that, where people do get caught in possession, and it is primarily cannabis. You know, Class A drugs are eligible for divert, but 90% of referrals are for cannabis use. And we have very, very few people come back again. So there is some evidence, emerging evidence, that we're having a positive effect on people's behaviour. And we've currently got NIHR, the National Research Council, funded evaluation of divert as well, part of a national thing. So we're hoping to get some solid evidence of the effectiveness of that.
Okay, Councillor Gareth Moore.
Thank you, Chair, and also like to thank the speakers for the comprehensive report on what is an important issue. On the issue of rehabilitation, obviously recognise that rehabilitation is important if we're to tackle this in the long term to prevent repeat offending, as it were. But I just want to drill down a little bit more into the information on page 3 relating to the pilot of, I assume, the O2R model. Because it talks about how initially started off with 60 clients being assessed as part of the pilot. That went down to 33, which then down went to 27 going into a rehabilitation facility, down to 4 completing the 12-week residential course. It talks about 20 were discharged early, but I don't know if that, I'm not quite sure what that actually means. And that, did they, you know, were they rehabilitated early, or was there some other reason why they didn't complete the program? But to go from 60 to 4 doesn't look very successful from my point of view. And whilst, you know, there's some lovely figures about how much money that's saved, I'm not quite sure how that's been achieved off the back of only 4 people completing the full course. Now that seems to relate to 21-2022. And then paragraph 14 then talks about some of the later years, but which then goes on to 37 people supported. But then there's no breakdown as to what outcome that led to. There's a nice pie chart with no numbers in, but it's just kind of like, so how I just want to drill down, is this actually working? Because from the suggestion from the pilot is actually that success was rather limited, because we went from 60 to 4, and then it's not clear what's happened afterwards. So can we have a bit more detail, perhaps outside of the meeting, as to what does being discharged early means, and of those 37 people in the following year, 2022-23, what actually was the outcome of that, because especially as we've gone from 60 one year to 37 the following year, which kind of suggests a downward trend. So I'd just like to have a bit more information. Is this actually working? Because if it's not, then we need to look at other options to ensure that how can we improve those referral rates and that success rate, because I agree that we need to do something about it, but we shouldn't be throwing public money onto stuff that isn't working. And my slight concern is, having read that report, it doesn't strike to me as a resounding success. My other question relates around to actually cracking down on drug dealers, because obviously that's another angle in this. And certainly as a ward councillor, the vast majority of crime-related complaints I get are people reporting suspicious vehicles, the quick handshake through the window and off they go, and they're reporting this information to the police, sharing the vehicle data, and it's just about what we're doing more effectively to work on that, because the public providing an awful amount of intelligence into the police force, which in theory should be, from the public's point of view, resulting in a lot of activity, but a lot of them become dissatisfied because they don't see anything. And I appreciate, they're not necessarily going to see the car stopped and people dragged out of it, etc., and searched, which is what they perhaps want to happen. But what's been done to reassure the public that that is a worthwhile endeavour? It's important they keep reporting that, especially with vehicles, because you can track them, and it may be the case that the vehicle they report gets pulled over at a later date and searched, and that person could go to prison. But the person who reported that, doesn't know, and quite often feels very dissatisfied. And I spend a lot of my time as a councillor trying to reassure people it's worthwhile reporting it, because it may not get a result immediately, but it will happen. And it's what can the police do to get that message out there and provide updates to the public of, actually, you reported this vehicle, we stopped it, this is what we found, this led to them going to jail or something like that. And that kind of update to reassure them that it's actually worthwhile and to continue persevering with that, because, it's really difficult. There's a lot of information out there that the police could use to crack down on this drug epidemic, but very little from the public's point of view seems to happen, because the same car pulls up every week and the handshakes continue. So if we can have an update as to what can be done to better use that intelligence, I'll be grateful.
I'll start with the offender to rehab. So obviously we can get a better breakdown for you in terms of those numbers. I know that over the last couple of years, there has been work to try and stabilise the programme because of issues with funding and also with staffing. So going into next year, many local authorities are using some of their supplementary, the SSMTRG funding they get from the Home Office, in order to put into the offending to recovery programme, in order to try and stabilise it, as you say, to make sure it is as successful as possible. So I know that in the future it should be more stable in terms of funding, and therefore leading to kind of better understanding of those numbers. But as I said, I can get a better breakdown for you. Did you want to?
Just there is an evaluation we can share that the office had done externally that we'll pass on, and also the programme is looking to broaden out from just being offender to rehab to being offending to recovery, because rehab's often looked at as this apex intervention. If we just get people into rehab, everything will be great, and it works really well for some people, and it's a phenomenal intervention for some people. Doesn't work for everybody. So the programme is looking to how it can support more community-based interventions as well, and get more people going through appropriate pathways as possible. In terms of your second point, I don't know if Simon or Jonathan is a better place to talk about the operational policing stuff, but I'm sure something can come back as well.
Yes, I mean, I absolutely agree with you that rehabilitation is key, because if you are successful with rehabilitation, it will mean less crime, less victims of crime, less pressure on policing, less pressure on our public services and our criminal justice system ultimately. And of course, it provides the opportunity for people to turn their lives around and make a positive contribution to society. As Jodie said, the offender to rehab programme has been academically evaluated, and that by BCU, and that evaluation is available publicly, I believe, isn't it? I think it is. I think it is. So I'm assuming that it is. I'd be very happy to share that with you, because it does drill down into the benefits of that programme and in more detail than is perhaps covered in this report. So I'd be very happy to share that with you, and it does provide more analysis over the success that's been achieved, not only as a consequence of each and every individual who has seen through that rehabilitation programme, because plainly, inevitably, not everyone who enters rehabilitation is going to see through the programme, as is illustrated with the brief description that's set out in the paper. But even if they are partially involved in that rehabilitation programme, it is residential rehabilitation, so they are off the streets and they're not funding the illegal drug economy, and they're not committing acquisitive crime in those circumstances. So that plainly does play partly into the analysis around the amount of money that's taken out of the illegal drug economy and the amount that's saved as a consequence of reducing acquisitive crime for local retailers. So that is part of the analysis in connection with that. Important to note as well that the offenders rehabilitation scheme has been nationally recognised. It has won a national prestigious award as a consequence of the work that's been undertaken in connection with that. So in terms of the enforcement side of things, which plainly equally is key to addressing this issue, what I would say is that inevitably people are not always going to have a report back from the police as to how that particular intelligence that they may have reported to the police has actually been utilised for obvious reasons. And sometimes people might well be reluctant for obvious reasons to want to have a direct feedback from the police as to the outcome of their having reported intelligence into the police, and indeed in some instances people would prefer to report that anonymously, again for obvious reasons. So it's never going to be the case that it's going to be possible to report that back in quite that granular detail. And of course, equally, the police are not going to want to compromise operational policing investigations by disclosing intelligence or indeed sources of information that has been provided to them in relation to drug activity in a particular area as well. So they're not going to want to compromise that information. And of course, it might also be part of a larger investigation. And there might be reasons why you build intelligence over a period of time in order to ensure a more effective, wider investigation, perhaps dealing with people higher up the chain, it might be more important from an operational policing judgment to be taking out of the equation rather than those low-level individuals who are using on the street, perhaps. So, but I agree with you. It is important that people have trust and confidence about the effectiveness of their reporting of intelligence into the police, and certainly use of social media can be a useful way to communicate that to people in terms of the outcomes that are achieved through the criminal justice system. And I think West Midlands Police do publicise successful outcomes through the criminal justice system when individuals receive appropriate long-term prison sentences for engaging in drug-related activity.
Okay, Councillor Heather Delaney.
Thank you. Two things from me. Firstly, page 13 of the drugs paper, you have a table which is the prevalence data for use of opiates or crack cocaine. Just a point really, slightly surprised to see a 2016-2017 data table put in there when there is easily accessible a 2019-2020 table available. I found it with a very quick search yesterday. It's a government issued paper. Just the point really that actually the most up-to-date data would be far more useful for us, especially because actually the local authorities have shifted around quite a lot between the 2016-17 and the 2019-2020 data. So just a point really on that one. But my question is particularly around the out-of-court discharges. We're aware that quite a lot of low-level drug use is self-medication, particularly around things like undiagnosed ADHD, undiagnosed autism, mental health difficulties. are stakeholders working effectively together with out of court discharges to actually look at the root causes? Because there is no point constantly doing out of court discharges if that system approach isn't in place.
So on that latter point, absolutely. So part of where there is an out-of-court disposal made and diversion happens, that the first thing that happens is that person has a one-to-one with a drug worker, and looking at additional vulnerabilities is one of the most important things with that, and making sure people are plugged in where there is greater needs identified, and especially with the drug dependency identified, but also some of the issues you've outlined, yeah, that they're plugged into the right support services. In regards to the table, the request was to summarise the needs assessment. So that's all. The table comes from the needs assessment that was published for CDAP. The 2016-17 data was published in 2019, and that's what was the most recent available data for the needs assessment. Yeah, as you say, there is new data, and when we refresh the needs assessment, we'll use the most up-to-date data possible.
Okay, thank you very much. We'll note this information and also look forward to receiving the evaluation. Oh, sorry, okay. Okay, come in, Councillor Bannon.
Thank you, thank you. Just a question regarding about the rehabilitation. So going back to the report in October 21, it was acknowledged where the importance of public confidence. Everyone in the, sorry, I'll go back. Simon Foster, in the report you wrote in October 21, you acknowledged the importance of public confidence within West Midlands Police is important. To understand police acts fairly and lawfully and in just to have confidence, and it's very important for the public to have confidence in the police. Now, that's very important. But what the report doesn't acknowledge is what we have in our community, and what I hear time over again in my searches when I speak to my residents is in Birmingham is being sort of inundated with exempt housing and social housing, where drug taking is prevalent. You have support workers coming in to work with individuals who are taking drugs, low-level drugs. That's not included in this. If we are to have residential programs where people are going to go in, is that also going to be in the community? Where will these residential services be taking place? Because it's a community who is being impacted. When they see that they're on their roads, you've got exempt housing, you've got individuals coming in where drug is being taken, the police is being called. All the complaints that I get, the police does not come out. They referred back to go to 101, register it on the one online portal. If they have registration numbers, fine, you could put it up. A lot of the time people don't have these registration numbers. They come back to us as counsellors to say, okay, what do? We are reporting these vehicles, we are reporting the antisocial behaviour, where we can smell the drugs, that it's being dealt with, it's being sold here, when nothing is being done. Then we're going to have the rehabilitation, where they go into residential, we go into cure them. But where will these services be taken? Will they be within the community? Where will these residential services be taking place? Thank you.
In regards to the offending to recovery programme, it's local residential rehabilitation providers that are primarily used. So Birmingham-based rehab programmes, which were used in the pilot. As I mentioned, one of the things the programme's looking to do is expanding those pathways that are available to use more community-based resources as well, and to plug people into the support services that are available across all the local authorities.
Do we not already have that through CGL and Kick It?
Yeah, absolutely. It's about making sure we can engage people in. So if people are coming identified through the criminal justice route because they're shoplifting and stuff, and it's the police that are the ones identifying that need for the first time, what the offending to recovery programme gives is a pathway into those services that that person might not otherwise find their own way to. So it's about ensuring that we're plugging people in wherever we identify them, whether it's in custody, through a local beat officer, through smelling drugs and catching someone in possession in the street, that we're getting people hooked up to the right support as quickly as we can to address that. I can't overestimate how big the scale of the issue is. You know, the drug market in Birmingham alone is huge. It's absolutely ginormous, as it is nationally. And I think we sometimes think this is a small thing. It's multi-billion-pound industry. And it's about ensuring that as part of the diversion programme, the wider diversion programme that the office is supporting, is how do we all work better? So it's that no wrong door approach. So if someone is identified with a drugs need, does everyone know the pathway to support that person into treatment? Can we help someone get the support that they need and want at that time? Because again, going back to Dame Carol Black's report, it's reducing demand that's going to have the biggest impact on our communities by getting people who have issues and want to make changes the support that they need at that time. I know that's not it's not the answer people want here, and people want the silver bullet. What's going to make the difference to the communities that are suffering from the drug trade? I don't know that silver bullet exists.
What people want. They want to see more visibility. I'm sorry, yeah. They want to see more visibility to stop the actual cause of who's supplying these drugs, who the dealer is. Not, you've got people coming around selling their drugs, and when the police officers do stop them, they probably don't have enough on them for an offence. They say personal use, but they want to actually stop the root cause. And the statistics again is finding them the route, but you have that already in exempt housing. A lot of this happens in exempt housing, and support workers are already following the multi-agency route of referring them on. So a track record is already being set that they have to have a track record of how many times they refer them, are they attending. How do you make sure someone engages?
And that's that silver bullet issue that it's difficult. I mean, people have to be ready, willing and able to engage in that level of support. They have to want to make changes. You know, what the skill is how we can engage that people, make lasting relationships, and that does take time. But I would push back a little bit on saying exempt accommodation is one area where drug use is prevalent, but it's not the only one. And drugs are used in all of our communities. And quite often the drug dealer isn't someone coming into communities. They're in that community, they're part of that community. And we know that they're in the communities with highest deprivation more than anywhere else. So the root causes, if you're addressing the root causes, it's why people are using drugs is the real issue. And it's shrinking the drug market by actually taking people out. Most people who use drugs, as was mentioned, do it because of underlying trauma, neurodiversity issues, mental health issues. There's a range of reasons that drug, especially the more problematic end of drug use. And we're talking about heroin and crack use, which cause, I mean, again, going back to Dame Carol Black's report, 90% of the costs associated with drug use are caused by the heroin and crack market, which is why ensuring that where people are identified as using heroin and crack, who are most likely to have the most vulnerabilities and unmet needs, that we get the support in place. If we can get that right, there will be a tangible effect. But at the moment, unfortunately, numbers are going in the wrong direction. But actually, Birmingham's one of the few that isn't. Birmingham is going in the right direction. There's more people in treatment every year for heroin and crack. Nationally, we're seeing a reduction. How can we get to use the money that's coming through OHID? How can we use it to really prioritise that group of people, ensuring more people get the support they need?
Also, I just wanted to reassure you in terms of what you were saying about exempt housing. We are obviously, we're aware it's a problem, and we're obviously really trying to push back on it as well. We are in communication with central government, because there is at the moment discussion and consultation around tightening up licences, and also actually defining what support people should be given in exempt accommodation, because as you know, it's vague to say the least. So I just wanted to reassure you, we are in constant communication with the government. We're just waiting for the consultation to come out so that we can really emphasise that as being one of the issues that we want to raise as well, because we are aware, unfortunately, it is a national issue as well.
Just one, sorry, very last quick issue on exempt housing, because we've got this paradox where we know people who are in exempt housing are using drugs, but we've got this situation where it's almost like don't ask, don't tell situation, where because of things that have happened historically, a lot of housing providers have got drug policies that basically just say zero tolerance, no drugs can be used here. Then they house people who use drugs, but we can't talk about it. If only we could work with people in a more open way, within the current laws, not talking about changing any laws, but where people can be honest about their drug use within these properties and actually talk to their support workers. We could reduce deaths. Some of the deaths that happened over, not the one pointing up there, sorry, but some of the deaths that happened over the summer, a lot of them were in exempt accommodation, people living by themselves, using drugs alone, no one there to help them. If they've been able to say, I'm going to be in my room, I'm someone who uses drugs, I'm going to be using drugs, someone could maybe have intervened earlier and actually help save lives.
Sorry, I'll just be really quick and over. Actually, on the the excluded licensing agreement, there's 5 criteria you have to have to be eligible for exempt housing. One of them is you're a drug user, so you'll be eligible for housing. That's a program that the support worker must follow. So maybe we need to tighten up that if that is one of the eligibilities, that you're a drug user and you are in exempt housing, there has to be a 6-month sort of paperwork trail, which has to be audited every 6 months. So that in itself is how much have they engaged, where have they been referred to, and what steps have been taken to put them in the right direction. So if they're not having that conversation, again, that's an area that needs to be looked into then.
It'd be good to pick up on this more, because it's an area I think we need to do a lot more work on. It's not necessarily that aware that they're a drug user, as in I'm someone with a drug dependency issue and I get support elsewhere. It's I'm living in your house and I'm using drugs. That's the bit that's don't ask, don't tell. So it's about looking more about behaviours. But yeah, it's.
Thank you.
I mean, I'd just add to that, Councillor, the part of this is about the importance of rebuilding community policing, of course, as well, because plainly we need that preventative, proactive problem solving, as you say, visible policing out on the streets, dealing with these issues and providing that trust and confidence and reassurance for people. And indeed, that is part of the rationale behind the launch of the new neighbourhood policing operating model that went live in April 2023. That is a key part of making sure that those, what are now 7 local policing areas, are better able to respond agilely and flexibly to the needs and demands of local residents in connection with those crimes, and in particular neighbourhood crimes that are of particular importance to your local constituents, as you've just mentioned. As Esther said, the government is committed to better regulating the exempt accommodation. As we know, that exempt accommodation has been allowed to grow like topsy in recent years, and many communities around the West Midlands, particularly in Birmingham, have been having to suffer the consequences of that, as we know. But the government is committed to better regulating that exempt accommodation and licensing it, something akin to that which exists in connection with HMOs, houses and multiple occupation. So that's very welcome, and I do hope that they will proceed at pace in relation to that. And then finally, part of all of this, of course, is, as I started off in terms of my introduction, it's about making sure that we also not only rebuild community policing, but rebuild the local authority commissioning services that are available, the substance misuse services, improving the quality and the capacity and the outcomes, and the need to rebuild that professional workforce that unfortunately over a number of years recently had been dismantled. And again, that takes time to rebuild that capacity and quality.
Thank you. I'll take the last question from Derek French and then we'll move on.
We all support the views that try to divert people. Once they've come to the attention of the police, they're found in possession of drugs, and trying to get them onto schemes in which we'll advise them as to withdraw from that particular addiction. What I was less clear about is, particularly in the light that there's less resources available for community policing anyway, where an officer might see someone on the streets and give them a friendly word of advice without having to contemplate arresting them, through education to try to get through to the kids before they ever get on the conveyor belt where they're using drugs and buying drugs and found in possession of drugs. So how much are we liaising with education to get the message across, you know, before they've got to that stage? And as I say, given the fact there's less resources for community policing, how much is being done formally through the various educational facilities to get that message across at the first possible stage?
Not enough. Nationally, not enough.
Yeah.
I think of the near £1 billion that's been invested, 30 million is going into primary prevention. mainly to grow the evidence base, because the evidence for what works to prevent drug use in the first place is poor. We know what doesn't work. We're not as good. So the Advisory Council for Misuse of Drugs published a report on this last year, looking at with a number of recommendations about what we should be doing around primary prevention in schools and around education. And it's going to be one of the government priorities for the next year, is how that evidence can be synthesised and then disseminated and actually have good prevention activities in place. But at the moment, not enough.
Yeah.
And speaking, I used to be a secondary school teacher, and I used to lead on relationships, sex education and health education in the school. Drugs is included within it, and it is mandatory. However, it will vary from school to school. Some schools will have a designated PSHE department and, you know, set in for the week. Some people would just be during tutor times with anyone who couldn't run fast enough, delivering it to them. So it is varied, and it is something that definitely, if there was a more consistent approach and it was delivered by people who wanted to deliver it, rather than just, oh, you've got space in your timetable so you can do it. So I welcome the fact that there was a looking at the relationships education and health education. It was very much needed. And as I said, it is technically mandatory, but it will vary, unfortunately.
Thank you.
And just the Chief Superintendent's just shared some information with me very kindly arising from operational policing activity since launch of the new neighbourhood policing operating model back in April 2023. So since the new neighbourhood operating policing model went live in April 2023 this year, there's been a 27% increase in possession with intent to supply. 359 of 906 solved, compared to last year 285 of 713 solved. So there's been an increase in kind of ratios there. Firearms recoveries have been significantly increased from 48 to 74. So very significant increase in firearms recoveries during that period of time. And there's been a record number of drugs lines shut down during that period of time as well.
Okay. Thank you for that. That's encouraging to hear that neighbourhood policing is having an impact, but also the issues, the questions have been raised, and education not being enough, even though it's varied across the country between different schools. It depends on the size of the school and the experience of the teachers and so forth. Yeah. They're under great pressure as well. But yeah, that's where we need to start, really work on. But yeah, okay, thank you. And also we look forward to getting that evaluation of the rehabilitation programme report. So thank you for that. We'll move on to the next item, which is an update on the Peel inspection report that came out on the 22nd of December. Now, we did have an early meeting on 18th of December, where the main areas of concern, there was 4 of them, to do with MARAC, sex offender management, online child abuse and investigations. We did look at that meeting, but the full report was released on the 22nd, so we will look at that opportunity today. But those 4 main areas that I've mentioned, we will be looking at those in February at our next meeting. So over to you. Okay.
Thanks very much, Chair. As you've outlined, Chair, HMIC published its Peel inspection report on the 22nd of December 2023, and I welcome publication of that report, and I'm pleased that as a consequence of my representations to HMIC, publication of that report was expedited. And that's important in the interest of clarity and transparency, bearing in mind my serious concerns in connection with the decision-making procedure, and that HMIC announced its decision to place West Midlands Police into Engage prior to the actual publication of the report. Now, I repeat that I'm treating this matter with the utmost seriousness and as a top priority. I'm committed to holding West Midlands Police to account and working with the Chief Constable, HMIC and other relevant partners to address and resolve the 4 areas of concern and the areas for improvement as a matter of urgency, so as to ensure that the people of the West Midlands receive the service from West Midlands Police that they are entitled to. I'm joined this afternoon by Chief Superintendent Thomas Joyce in connection with the presentation of this agenda item. I'll be providing the panel with an introduction, and I'll then pass over to the Chief Superintendent, who will be providing you with an overview of the action that's being taken regarding the key areas for improvement. As you say, Chair, we concentrated on the issue of the areas of concern at the meeting on the 18th of December. It's not my intention to attempt to summarise the entirety of the detailed 56 pages long report within this agenda item, and it's not our intention to focus on the 4 areas of concern because, as you say, Chair, firstly, I attended an extraordinary meeting of the Police and Crime Panel on the 18th of December that was dedicated to considering and discussing the decision of HMIC to move West Midlands Police into Engage and the 4 areas of concern. And secondly, the appeal report has been publicly available since the 22nd of December 2023. And thirdly, that doubtless members of the panel will already have read the report in full. In any event, it's been agreed that the panel will examine the progress addressing the 4 areas of concern identified by HMIC at its meeting on the 5th of February. The Chief Constable will be attending that meeting in order to speak to the panel about the action that's been taken, is being taken, and will continue to be taken to resolve the 4 areas of concern. In addition, the Chief Constable and I are attending the Policing Performance Oversight Group meeting tomorrow on Tuesday, the 16th of January, in order to present the improvement plan to the Oversight Group. And we'll be able to report back to the panel from that group meeting on the 5th of February. The outcome of the HMIC process must be relentlessly focused on preventing, tackling and reducing crime, protecting vulnerable people and improving access to justice, safety and security for the people of the West Midlands. Unless that is the outcome of the process, then it is of limited value. It must be relentlessly outcome focused. I'm mindful as well of the severe pressure that police officers and staff work under, and it's important that the HMIC process does not undermine their commitment, dedication, morale and professionalism, because if it were to do so, it would be entirely counterproductive. The holding of West Midlands Police to account is the responsibility of myself as Police and Crime Commissioner. But just as the police cannot prevent, tackle and reduce crime all on their own, there will always need to be a collective collaboration. And that includes the contribution of HMIC, inspecting and reporting on the efficiency and effectiveness of police forces, the College of Policing, setting standards of professional development, training, skills and qualifications, and the Independent Office for Police Conduct to investigate serious complaints and allegations of misconduct. The HMIC inspector noted in the summary that West Midlands Police has implemented a robust performance framework to make improvements, reviewed its operating model, taken rapid action and made rapid changes to it. But that West Midlands Police faces acute challenges and factors that affect its ability to meet demand, including, as the inspector observed, the West Midlands also has high levels of deprivation. The rate of permanent exclusions from schools in the region is higher than the average in England. This means children are more vulnerable and more likely to be exposed to criminal exploitation. In the year ending 30th of June 2023, West Midlands Police recorded 14.4 homicides per million population, the 5th highest of all forces in England and Wales. 42 people lost their lives to homicide in the West Midlands, the 2nd highest number after the Metropolitan Police area. And that West Midlands Police's funding reduced by 13% per capita between the year ending 31st of March 2014 and the year ending 31st of March 2020. And this means that it's been affected disproportionately compared to some other forces and has little opportunity to obtain additional funds from increasing the police precept. West Midlands Police needs to have enough resources to prevent crime and protect the public effectively. They're not my words, they are the words of Her Majesty's Inspector of Constabulary. Finally, the action that is being taken to address the areas of concern and resolve the areas for improvement includes the Peel inspection report. The areas of concern and the areas for improvement are all now standing agenda items at my weekly meeting with the Chief Constable. The Chief Constable and I met on the 28th of December for a pre-meet in preparation for the Policing Performance and Oversight Group on the 16th of January. We'll both be attending that group meeting on the 16th of January, as I've already mentioned. The Peel inspection report, the areas of concern, the areas for improvement, will be standing agenda items at my monthly Strategic Policing and Crime Board. I've set West Midlands Police a target of the 31st of March 2024 for being in a position to be able to present a compelling case to HMIC for removal from Engage in record time. Members of my OPCC team will be represented on the West Midlands Police HMIC board and the West Midlands Police Risk Board. My Office for Police and Crime Commissioner Performance Analyst is in the process of agreeing metrics and reporting in order to be able to monitor progress regarding the areas of concern and the areas for improvement. And there is joint partnership work taking place between my office, West Midlands Police, local authorities and partners in connection with the action required relating to MARAC. The joint internal audit team will be identifying a programme of work arising from the Peel inspection report to monitor progress and identify recommendations and risk management. And there'll be regular updates and reports for the Police and Crime panel. The format, issues and regularity of which are to be discussed and agreed with the panel. I'm now going to hand over to Chief Superintendent Thomas Joyce to take you through the key areas for improvement identified within the report, and of course we can then take any questions. Thank you.
Thank you, Commissioner. So folks, as the Commissioner's alluded to, the report is a fairly lengthy one with a number of AFIs listed in addition to the causes of concern. I suppose some of those AFIs are quite specific around things such as how our Health Human Resources Department works and so on and so forth. So I won't go through all of them, but I will try and focus on the ones I imagine would be of most interest to the panel, such as those that relate to service to victims. If there are any questions, I'll do my best to answer kind of more widely than that afterwards. It's probably important just to highlight in context for this report, the Chief Constable arrived in December 2022, and he basically immediately commenced the development of a new operating model. So prior to April of this year, West Midlands Police had a directorate-based model. So for example, there was a single force investigations department, a single force response department, a single public protection department, and those three departments were ostensibly, with about 3,000 staff between them, responsible for responding to all calls for services and investigating all crimes, including public protection crimes. The new operating model, which is a local policing model, shares out that response and investigative resource and some of the workload amongst local policing areas, moves some of the resource around, and effectively means that in Birmingham, for example, all responding, all investigating, all the rest, everything is under the command of a single chief superintendent who has an enlarged workforce to deal with that. The effect of that is essentially having something like 6,500 cops to deal with the demand that previously was being dealt with by 3,000. So some of this is about the uplift in police officer numbers, but a lot of it is about the new operating model. In addition to that, the Deputy Chief Constable arrived in April 23 and instigated a new performance management framework. The first meeting of his new framework was held in May. They're held monthly thereafter. And within those areas are a number of key standing agenda items such as response times, investigative outcomes, arrest rates, 999 call performance, so on and so forth. The relevance of all of that is when we're inspected, there's kind of two things to kind of call out. One, the inspection is based on data that in many cases was a 12-month rolling average that finished in March 23. So actually the data that HMIC had to use to make their inspection findings predated the new operating model. There was some data such as 999 data which went as late as June 23, and there were some bits of thematic work done in terms of field work. but most of the data that's been collected is relevant to the sort of 9 to 10 months before the new operating model was launched. The other point is we've had a standing invite for HMRC to come to the performance meetings, and much of what they identify in their report are effectively things that we have told them about ourselves. So we told them, for example, that we knew that our 999 call performance needed to be improved. We told them our response times needed to be improved, and so on and so forth. So it's important just to recognise that those elements that have been identified as AFIs are often things that we knew about, we're taking steps to fix in advance of the inspection, and we're already able to tell HMRC about. So if I just pick out a few of those to kind of talk about in a bit more detail, and as I say, I can try and answer questions on anything else. So one of the AFIs is very simply the force needs to make sure it answers emergency calls quickly enough. Clearly, that's a basic requirement of any policing services to answer 999 calls. And the report at the time described data for the 12 months leading up to 30th of June 23, showing that we were answering about 75% of our 999 calls within 10 seconds, which is the standard target time. In the sort of the first 6 months of the year, one of the chief's first actions was to restructure our force contact department. So there was an injection of additional resource and also then a movement of separate hubs to one central location to try and improve the ability to flex across demand. Since June this year, essentially, or June last year, every month has been at 90% or above bar 1 month, and actually the 12-month rolling average is now at 89%. The average time to answer a 999 call as of December is about 2 seconds. So this performance is basically putting us in the top sort of 10 of the country consistently for the last 6 months. To give you some context around that, West Midlands Police answers about 63,000 calls in a month. That's more than the whole of Police Scotland combined. So the other forces that tend to outperform West Midlands Police now are forces like Lincolnshire, Gwent, quite small rural forces, don't have anything like the demand that West Midlands does. And that performance has been sustained ever since. Put simply, if we'd been inspected at this point, there would have been no reference to our call handling as a result of improvements achieved. There's a second AFI which links to that, which talks about the number of non-emergency calls that are abandoned. So apart from 999, you have 101. And they talked in the report about 34% of calls to 101 being abandoned before they were answered. Now, that was essentially down to the amount of time it was taking us to answer 101 calls. I think our SLA for the first 6 months of the year was something like 30%. So we were only getting to 101 calls within the 3-minute target about 1 in 3 times. That's dramatically improved in the last 6 months again. In December, for context, we were actually at 90% for our 101 call demand. So not just 999, but also the non-emergency has dramatically improved. When I did some calculations on this not too long ago, the actual abandonment rate in August was already at 10%, and the year to date had dropped to 15%. Our expectation is by the end of the year, we will have one of the best abandonment rates in the country. Clearly, answering the phone is then has to be followed up by attending calls for service. And again, that's an area that the inspectorate called out because we identified ourselves that was one of the major problems. The way they did that was by looking at 63 cases from their case file review and looking at whether or not the response times were met. We've got a far more systematic approach to tracking our response times now. And what we can say is that when we were inspected, we were probably attending P1 grades, the most significant risk jobs, within the 15-minute target about 48% of the time. As recently as December, we've been hitting 65, 70% in terms of the number of calls achieved within that 15-minute target. And indeed, our median response time is now about 12 minutes. So most of the time, we're getting there within the target and with something to spare. Similarly, priority grade 2 calls, which is where there's still quite high risk, but not the same degree of urgency. This time last year, it was taking us on average a median of about 1 hour 55 to get to those jobs. We're now at 59 minutes, which is within the 1 hour SLA. So again, these are things that we might still have been asked to improve further around the volume of response jobs that we get to within the SLA. But certainly the performance now is almost twice as good as it was when we were inspected. One of the things that's called out, which would clearly cause some concern, would be, given some of the cause of concern that I talked about tomorrow at PPOG, was an AFI in relation to managing outstanding suspects and offenders. So one of the things that the force tracks is the number of suspects who are identified on a crime report who have yet to be arrested or brought to justice. And probably a big part of that was because of the low arrest rate that the force had relative to the size of the force. So around about October, November last year, the typical monthly arrest rate was about 3,200. It's pretty consistently now 4,300 arrests a month. So we're seeing something like a 40% increase in the rate of arrests. It's now the case that there is of all of our outstanding domestic abuse offenders, 40% have been arrested at any given time. That might sound like only 40% of DA offenders have been arrested isn't very good, but actually for a metropolitan force, that's a pretty high rate of DA offenders that actually have been arrested, and many more will be dealt with by alternative means. As a result of that, the outstanding offender rate is reducing month on month, and the most recent data shows we're down from about 10,000 to 7,500 outstanding offenders at any given time. A certain amount of that is natural churn. You will always have some outstanding offenders because from the date that's reported to the point they get arrested can be, even if it's 24 hours, there has to be a certain number of people every day who become suspects. Probably linked to that, given it's about managing suspects, there was a particular AFI around the issuing of domestic violence protection notices. And one of the key things to understand about the new operating model is that the Public Protection Unit, which still is a standalone department within West Midlands Police, is being allowed to focus more on the high-risk priority offenders, and some low-level domestic abuse offences are now shared out amongst the local policing areas. As a consequence of that, we've seen an increase in the number of DVPNs and DVPOs, which are the orders that are issued by the court subsequently. And we've also seen in the last month a significant increase in the number of evidence-led prosecutions, which again was another AFI that was called out. So there were about 25 evidence-led prosecutions carried out in the last month. These are both signs of how the new operating model is allowing us to do some work that previously we weren't getting to. And I suppose just to kind of highlight the point that the Commissioner made in response to the question around what we do about sort of drugs and so on and so forth. Notwithstanding the need for rehabilitation, there is definitely a clear problem in West Midlands Police with organised crime. The new model has a dedicated county lines task force, which is part of the major crime team. That's partly how we've been able to generate record numbers of drugs lines being shut down using new legislation. It's also, as the Commissioner alluded to, seen an increase in firearms recoveries from about 48 last year to 74 this year. That's coincided with a flip in the number of discharges. So discharges are down about 30% as a result of the kind of the high levels of recovery and investigative work. And the point about the increase of possession of intent to supply offences. So we identified a further 900 offences of possession of intent to supply, of which 359 were solved. Possession of intent to supply is one of those offences you identify not through someone phoning up and reporting it all the time. Quite often it takes quite good intelligence-led work, it takes quite good covert investigations. And so the fact that we've seen a 27% increase in that is a sign of us being able to be more proactive as a result of the new operating model as well, with more investment in local policing. Now, I think the Chief or the DEP, if they were here, would say very clearly, none of this is where the force needs to be in the long run, because there are still improvements to be made. We still want to increase further the number of arrests. We still want to improve our response rate. But what I think you can see is essentially on every important metric that the public would expect us to be delivering around, you can see significant improvements. We are actually now solving more robberies, burglaries and homicides than most of our similar forces like GMP, Greater Manchester Police, West Yorkshire and Merseyside. So the kind of findings that HMRC would have found had they come in now, we would respectfully submit would be very different, and we'd have had a very different report as a result. So that's probably a kind of whistle-stop highlight of some of the kind of observations I made about the AFIs, but happy to take any questions.
Thank you, Simon and Superintendent Joyce. Okay. Okay, I'll go to Derek Francis.
Obviously, I'm pleased, Chief Superintendent, that progress has been made about answering the phone more quickly and arresting more people. But the particular things which leap out from the report, two areas which the force regarded as being inadequate, were protecting vulnerable people, inadequate, and effectively investigating crime, which are the two key things you think about, that you're there to investigate crime successfully and to protect the vulnerable. I think the figures that they're quoted in the report, I think it's page 24, that this report says that in our crime file review, we judged that only 54 out of 100 investigations were effective. That is concerning. So aren't those the areas? It's fine you answer the phone quickly, it's fine you arrest people, but if you're not protecting the vulnerable and you're not successfully investigating crime to a satisfactory level, aren't those the key issues you should be focusing on?
Okay, just hold on. I think this is something that we're going to be looking at next in February.
I appreciate that in detail, Chair. But the inspector's telling us about where he thinks things have been addressed. This is part of the other things that the Chief Superintendent surely is addressing as well.
Yeah, I think as we outlined at the commencement of this agenda item, we're going to be focusing on the areas for improvement this afternoon. Plainly, we spent 2 hours talking about the 4 areas of concern, including investigations, as you quite rightly highlight, on the 18th of December, and we're going to return to the areas of concern, the 4 areas of concern, including investigations, on the 5th of February, at which the Chief Constable will also be present. So I think it would be interesting to talk about the 4 areas of concern again, but I think we had as a brief for this meeting that we were not going to be focusing on that this afternoon. We're going to focus on that on the 5th of February. We had 2 hours talking about it on the 18th of December. The Chief Constable will be here on the 5th of February, and we'll be able to report back from the Police Performance Oversight Group meeting, which is taking place tomorrow.
Thank you. Councillor Gareth-Moore.
Thank you, Chair, and I'm grateful for the update on this report. And it's obviously, having had the opportunity to read the report over the Christmas period, it was grim reading, and it was concerning, just the number of concerns that were identified as part of that. I accept it was done before the new operating model and the reasons given for that. I know I don't want to dwell on it too much because I know we're going to be looking at this in February, but I do hope that that update, I'm not sure how you're planning on shaping it, but actually mirrors what the various issues that were identified in the report, because it would be very useful to see what's been done to address each individual point that was identified in the report. And I suppose the reassurance I would like at this stage is that there were a number of recommendations within it, some of them to be done in 6 months, some of them were identified as immediate. Have all those which were identified by HMIC as immediate, have they been actioned now? And can we be reassured that the immediate concerns have been addressed?
So I suppose, again, it sounds part of the etiquette of the timing of this response is obviously that the rightful response from the Chief Constable on some of the operational performance issues is to PPOG tomorrow, which is partly why we're focusing on the AFIs, and then we should come back and see you in February. Just some of the delicacy around that, I guess. What I can say and give you assurance around is every single one of the causes of concern that identified immediate improvements required, those immediate concerns have been addressed.
I mean, I would just add that the Chief Constable has prepared a detailed improvement plan that he will be sharing with the Police Performance Oversight Group tomorrow, Tuesday, 16th of January. And I'm quite sure he will in part, if not in full, be drawing upon that and sharing the update in terms of progress around those matters you refer to at the meeting on the 5th of February.
Okay, Christina Murphy.
Thank you, and thank you for the update. My question is really around, is the 31st of March realistic, given that actually the data sets that they look at are largely historic? There's quite a long delay in terms of them being published, and therefore, given their reliance on some of those data sets and some of the frustration that that's previously caused, is there going to be newer data that actually shows the impact of those changes and progress made that will then support that?
Ultimately, the decision as to when West Midlands Police are removed from Engage is plainly not a matter for me or for West Midlands Police. It'll be a decision for Her Majesty's Inspectorate of Constabulary. I believe that is certainly a realistic timescale in connection with the 3 of the 4 areas of concern. I think the more challenging one will be investigations. And I would say, and the Chief Constable can of course speak for himself, but my understanding is that much of the action has been put in place to deal with the issues around MARAC and offender management and the online child sexual exploitation. The action, the structures have been put in place to address those issues already. The more challenging issue will be around the investigations. And I think one of the key challenges as far as making a case to HMIC for removal from engagement will be around being able to provide them with the confidence that the changes that have been put in place will result in sustainable improvement over a period of time.
And I think also it's in terms of that governance and the reliability in terms of your internal data sets. So is that now in place in terms of being able to monitor that from an internal perspective to be able to demonstrate that sustainable improvement from the data sets?
So short answer is yes. The main responsibility I have as head of our corporate development department is to put in place a system of performance reporting that could give it's technically the Deputy Chief Constable is responsible for performance of the force and is responsible to the Chief. We've overhauled our performance management systems so that we can track pretty much everything that's listed in that report down to quite minute detail. So without getting into the stuff you'll talk about in February, the Chief will be able to come and describe to you the kind of the level of performance reporting that allows us to track individual officers within the force against some of the high level recommendations that have been put in the appeal report. The problem is our data is up to date as of the end of the last month. I can get a weekly report out. In fact, there's a weekly report come out today that will show our outcome rate improving again. We can see all of that. But the nature of our returns to central government and the lag time means that we're generally at least 6 months ahead of what they will then rely on as ONS approved data. So I suppose the point being is we know already that we're doing lots of this much, much better. The problem will be being able to evidence that through the ONS.
Councillor Heather Delaney.
Thank you, Chair. And thank you, Chief Superintendent, for your report. I know at the December panel meeting, I think most of us that were present, if not all of us that were present, expressed our confidence in the work that the Chief Constable and his team has done since he started. And I think your report certainly reflects that he is making very swift changes, which I think we are all reassured to see. And I certainly would like you to pass on mine, if not the whole of the panel's appreciation for the hard work and the rapid improvement that is being shown. My concern, both really, is that the previous appeal report, which was November 21, was significantly better than this one. As Police and Crime Commissioner, your role is defined as securing efficient and effective policing. The inspector's report clearly notes that these areas for concerns have been highlighted by HMIC and that the decline has been highlighted over time. Can you tell us when you first knew that these areas were in decline? Because this report can't have come as a shock. The report says that the decline was being noted. So when were you as Commissioner aware of the decline, and what have you been doing to try and change it? Because clearly since the new Chief Constable has come in, there's been a rapid turnaround, but these declines don't happen overnight. So, it would be nice to be able to track back that history and work out when the decline started.
I think the challenge and the decline in relation to these issues has been building for many, many years. I think it's been building over a period of about 13 years, because it's over that period of time that West Midlands Police began to suffer significant cuts to financial funding. As we know, there was a period of time during which, between 2010 and 2019, West Midlands Police lost £175 million of funding. That resulted in West Midlands Police losing 2,221 police officers. That was 25% of the police officers went during that period of time, building up from 2010 over a period of time up until 2019-20. West Midlands Police lost about 400 police community support officers, as well as many hundreds of essential police staff. And of course, West Midlands Police have been severely and significantly underfunded during that period of time as a consequence of failure to implement the funding formula that cost West Midlands Police £40 million a year. So all of this has created a situation that has been building over a period of time, and it has been very difficult trying to manage the issues around capacity and capability and quality during that period of time. Now, I'll give you an example in terms of, for example, investigations as to how that has built over a period of time. During that period of time, as a consequence of losing those police officers and police staff, you lost significant capacity and quality and capability within investigations, because a lot of it went during that period of time. Now, it's been a consequence of the modest increase in resources that has taken place during the period of the so-called 3 years uplift since about 2019. We lost 2,221 police officers. That uplift partially returned those. They partially returned about 1,200 of them, about 50% of those that we lost. That has provided an opportunity to implement a new neighbourhood policing operating model that was simply not previously there before. That increasing capacity has enabled us to do that. But you've got to remember that as a consequence of that loss of skills, knowledge and expertise and experience over that period of time has had to be replaced by essentially new officers. So within investigations, you've had a situation in which investigators, more often than not, have been having to carry file loads which are above and beyond what they could comfortably manage themselves effectively and efficiently. Now, what happens then is that when investigators have caseloads that are in excess of those that they can manage effectively and efficiently, is that they are unable to communicate with victims as effectively as they would want to do. They end up missing deadlines more often than they want to do. They're unable to pursue reasonable lines of inquiry as effectively and efficiently as they want to do. And of course, that means people end up complaining. And then quite often people go off sick as a consequence of being under that severe stress and strain and anxiety. And that builds and it builds over a period of time. And then you've often got supervisors who have significant caseloads themselves, who end up having to supervise more new student officers coming in than they are able effectively and efficiently to do. And again, that builds pressure because the supervisory ratios aren't as efficient as they need to be. You've got a situation in which, because student officers, new officers are coming in as part of that new uplift, you've got a situation in which there's a significant turnover. So anyone who has run a caseload in any context, I mean, I spent 37 years doing it, so I do know what I'm talking about here. It's the worst of all possible worlds, because you have then as well a turnover. So you might have a student officer who comes in for 6 months, 12 months, reads the file, and then moves off to experience another part of policing. Somebody else has to come in and pick that case up all over again, and the process repeats itself. It is the worst of all possible worlds. If you were wanting to devise a system that was not going to be effective and efficient, that's it, believe you me. And anyone who has run a caseload of any sort will know that that is the worst situation. And also complexity of cases. You have a situation in which new student officers are often having to deal with levels of complexity of case that are not commensurate with their levels of experience. So perhaps you might have new officers having to deal with cases that ought to be dealt with ideally by officers with 10, 15, 20 years of experience, having to deal with cases that are above and beyond, that they don't have the level of expertise to do. So this builds over a period of time. And it's as a consequence of the modest increase in resources that has come into the force in the last 3 years or so, and the appointment of a new Chief Constable, an opportunity to look at this afresh, and his decision to launch a new neighbourhood policing operating model in April that has allowed these changes to drive the changes that the Chief Superintendent has outlined in his summary report today. And I do believe that over the medium to long term, you will see significant improvements around all of this. But it does take time, and it does take patience, and it has had to take that modest increase in additional resources to enable that to happen.
If I could just come back, please. I'm afraid to me your answer doesn't stack up. So you're blaming funding cuts from 2010 to 2019, which we all accept. We all accept that when the Conservative government came into power, there was no money. We all accept there were funding cuts, and that's not helped. However, the previous Peel report was in November 2021 that was significantly better than the current Peel report. You're saying that the uplift over the last 3 years has enabled performance to get better? It's the other way round. Performance under your watch has got worse. But you didn't actually answer my question. My question was, when did you specifically know that performance was declining? It's not about what created the decline. We've heard about that. My question is, when you specifically knew that performance since the November 2021 Peel report was declining? And on the subject, do you accept any responsibility for the performance failures, being as your role is to ensure effective policing?
So I think anybody who has had any involvement in policing, either within West Midlands Police or in any other capacity, experienced policing, not only in the West Midlands but across the country, who has had to rely on policing services in recent years, it's not a secret that over a period of time, and this is not something that any of us in this room have not been aware of, that over a period of time, as a consequence of the pressure that has been building in terms of resources, that there has been a significant adverse impact on police visibility and presence, response times, the ability of the police to conduct investigations, the rights and welfare of victims, community safety, and the ability of policing to prevent, tackle, and reduce crime and protect vulnerable people. That is something that each and every one of us in this building, in this room, is aware of. It's something that every member of the public around the West Midlands will be aware of. So when did I first find out about it? I've known about this for as long as anybody else in this room has known about it, for as long as any other member of the public has been aware of the significant pressure that has been placed on policing and indeed preventative public services in general, and indeed our criminal justice system, because you can't just look at policing in isolation. You have to look at essential preventative public services, because that has an impact on policing as well, and as well the criminal justice system in the widest possible sense, because of all of that has an impact. And yes, of course, I am the Police and Crime Commissioner. It is my job to hold the Chief Constable to account and the West Midlands Police to account on behalf of the public. That is what I am doing, and that is why I am holding the Chief Constable to account. I'm holding West Midlands Police to account to drive these improvements that we've heard outlined in the Chief Superintendent's summary this afternoon, and which we reported back to you on the 18th of December at the meeting, and which we will report further back to you on the 5th of February. And I'm working with the Chief Constable, as well as holding him to account. I'm working with the Chief Constable and HMIC and other relevant partners in order to ensure that we improve West Midlands Police and make sure that the people of the West Midlands receive the policing service that they are entitled to. And that is my top priority, and I am taking that with the greatest level of seriousness, I can assure you.
Thank you very much. I've got a couple of questions. Okay. Are there any issues identified in the Peel inspection report that have impacted on the delivery of your police and crime plan objectives? Shall I repeat it? Okay.
Sorry, I didn't realise you were asking a question.
Yeah,
Sorry,
no,
Jack.
no, we want to quickly move on because we've got some. Yeah. Are there any issues identified in the Peel inspection report that have impacted on the delivery of your police and crime plan objectives?
I mean, plainly, there's a number of matters that are identified within the Peel inspection report which impact on the police and crime plan, right from in terms of the priority around rebuilding community policing. That's a key issue. You'll notice for those who have paid some significant attention to the areas for improvement, I draw people's attention, for example, to the area for improvement in relation to preventing, deterring crime and ASB and reducing vulnerability. So that area for improvement there is identified as the force needs to make sure that neighbourhood officers aren't diverted away from their main duties due to demand on response teams. And that is a regular refrain that I hear from local neighbourhood police officers. Many of them express frustration at the moment that they are not able to devote as much time to those core key community policing duties as they would want to do. And so that is something that I know West Midlands Police is aware of. It is something that I am in regular discussions with them about. That's one of the reasons why they are currently in the process of devising an abstractions policy in order to provide a degree of ring fencing for those community police officers to make sure that they're better able to focus in on those core community policing duties around prevention and proactive and preventative visible policing. I mean, that's one very good example, I think, that's where an area for improvement identified by the HMIC inspection impacts significantly on the police and crime plan.
Thank you for that. Another question. How are you monitoring progress in addressing these areas classified in the Peel report as requires improvement?
Yeah, thank you, Chair. I mean, I think I addressed that in my opening remarks. I perhaps won't take you through all of those point by point as I did in my introduction. But for example, the Peel inspection report, the areas of concern in the areas for improvement are all now standing agenda items in my weekly meetings with the Chief Constable. They'll all be standing agenda items at my monthly Strategic Policing and Crime Board. I'm also making sure that my Office of the Police and Crime Commissioner team will be represented at the West Midlands Police HMIC Board and the West Midlands Police Risk Board. I repeat that my Office of the Police and Crime Commissioner performance analyst is in the process of agreeing metrics and reporting in order to be able to monitor progress regarding the areas of concern and areas for improvement. So there's a whole raft of work that is taking place to make sure I am in a position to be able to monitor and provide oversight and scrutiny of the action that needs to be taken in order to address the areas of concern and resolve the areas for improvement.
Thank you very much for that. Put it to We note the findings in the inspection report and the information provided by the Simon Foster. Okay, thank you very much, and we look forward to receiving reports in other meetings as we go forward. Updates. We now move on to agenda item 9. This is the Police and Crime Commissioner update and key decisions. Over to you, Simon. Yeah, you have prepared an update report on the recent activities that we have received and the key decisions attached. So thank you.
Yeah, thank you very much, Chair. I mean, I refer the panel to the report that is been circulated with the agenda pack. You'll see that it covers a range of activities that I've been engaged in the last 2 or 3 months as Police and Crime Commissioner in the West Midlands. I'll run through those just briefly for the benefit of the panel. The first item is in connection with the HMIC inspection report. Perhaps I won't detain the panel further in running through that, because we have actually covered that in significant detail on the 18th of December and again this afternoon. So I will skip over that. Moving on to the Provisional Police Grant 24-25. I think you've benefited from a briefing about that before this substantive meeting commenced. But you'll be aware briefly that the government announced its Provisional Police Grant on the 14th of December 2023. I believe that West Midlands Police received the 6th worst percentage settlement across all forces, which was disappointing. We have a preset flexibility of £13 per annum per bandee property this year. When the government announced its original 3-year settlement, the plan was that police and crime commissioners would have a £10 per annum per bandee property flexibility. The government extended that last year to £15 per annum per bandee property. This year we've got a figure somewhere in between £10 and £15. And that will generate about 11.7 million if you include the tax base of 2.1 million. West Midlands Police were facing, if you remove the ability to utilise that flexibility, West Midlands Police were looking at a deficit of about £27 million this year in terms of its budget gap. And so even with the benefit of that, we're still looking at a budget deficit of about 14 million or so. I mean, you may well have heard during the course of the presentation the action that's taking place in order to be able to ensure that we can set a balanced budget this year. We plainly still have the flawed and unfit for purpose funding formula that remains costing West Midlands Police £40 million a year. I have responded to the government's consultation around the Provisional Police Grant. We submitted that response last week. I have made 2 particular points to the Policing Minister. One, I'm really urging the government to get on and sort out reform of the police funding formula, because it has been long overdue. The government has been promising to reform the policing funding formula, I think, for about since about 2015-14. So we've been waiting about 8 or 9 years for this, and they still haven't got round to dealing with it, which was completely and utterly unacceptable and inexplicable and inexcusable, quite frankly. Secondly, I've also said to the Policing Minister, because there's going to be an opportunity to bid in for some more police officers this year, about 625 will be up for grabs across the country, and I've suggested that the Policing Minister might want to give consideration to prioritising those forces who have most significantly lost out as a consequence of the so-called National Police uplift, and ensure that we are allocated a significant share of those 625 police officers. You might be aware that we had an opportunity to bid in some extra police officers last year. We managed to bid for an extra 100 as a consequence of that. We also had another second opportunity to do that, and we were allocated 75. I mean, disappointingly, I noticed that Greater Manchester Police managed to achieve about 160 officers when we only received about 75. Don't quite know, or was it 100? Either way, we were somewhat disadvantaged for reasons I am yet to be able to to understand or are capable of explaining to me. But we will have a police and crime budget report that's going to be available on the 5th of February, and I'll be attending to present that report to the panel on the 5th of February. I launched my consultation on the budget, of course, on the 14th of December, the very same date that the provisional police grant settlement was announced. West Midlands, as you know, West Midlands Police, the Band D policing precept is the second lowest in the country at £202.55. If I decide to take the flexibility, the £13 per annum per Band D property, that will increase that to £215.55. That would be an additional 25p a week if you're a Band D council tax payer. And as I say, without that flexibility, we're facing a £27 million budget deficit in any event. I normally have a meeting with the local authority leaders across the West Midlands in order to present the provisional budget to them. I'm hoping to be able to have that meeting this month, as well as I have done in the previous 2 years, and the budget consultation closes on the 31st of January. So welcome any submissions, contributions to completing the consultation before that date. I have my annual business summit on the 18th of January. That's also an opportunity to brief local businesses in connection with the West Midlands Police budget. And we also usually focus in on a key theme. So, for example, last year I we launched my second chances charter around rehabilitation for those people who have convictions and who want to get into work. And this year we're going to be focusing in on the cost of living crisis and its impact on business crime. I've been working throughout the year with businesses who have been victims of retail crime, fraud, and indeed violence towards retail workers. So we're going to be focusing in on that theme of cost of living crisis and impact on business crime. We have a number of speakers who are going to be coming who have significant experience and expertise around those areas. And it's all going to be about improving partnership in relation to the way that we prevent and tackle and reduce crime and antisocial behaviour for local businesses. Policing governance. You will be aware that the Levelling Up and Regeneration Act received royal assent on the 26th of October 2023, and the Mayor formally wrote to the Home Secretary on the 2nd of November formally requesting transfer of Police and Crime Commissioner powers and functions to the Mayor. I wrote to the Mayor and the Home Secretary opposing that transfer on the 6th of November. And then the Home Secretary wrote to the Mayor approving the transfer on the 6th of December 2023. I then wrote a letter challenging that decision on the part of the Home Secretary on the 8th of December. As a consequence of that, the Home Secretary then launched a public consultation, which he had hitherto had no intention of launching, because the Home Secretary and the Mayor did not appear to have any interest in hearing from or having regard to what members of the public thought they wanted. I drew attention to their failings in that regard and the fact that their approach was certainly unlawful, and as a consequence of that they were forced into a humiliating climb down and launched that public consultation on the 20th of December, and I'm very pleased that they did. That public consultation closes on the 31st of January 2024. I have also written again to the Home Secretary pointing out the flawed and unlawful nature of the consultation that he launched on the 20th of December, because we have a curious situation. As you will know, in government, the usual convention is that you hold a consultation and then you make a decision. The situation we have here is that the Home Secretary has already made a decision, and he is now consulting in connection with the decision that he has already made. Plainly, that is a farce. So anyway, we will see how matters progress in connection with that. I convened a West Midlands Anti-Slavery Day conference on the 18th of October. It highlighted the extensive and wide-ranging work that my office is undertaking in connection with preventing, tackling and reducing modern slavery, and in safeguarding victims, and indeed making sure that those people who are involved in modern slavery are held to account by the criminal justice system. And that includes 3 particular projects that I fund across the West Midlands in connection with modern slavery, which includes the West Midlands Modern Slavery Network, the Adult Slavery Safeguarding Case Conference, and also the Independent Modern Slavery Advocate. Moving on to my Youth Commissioners and Youth Assembly. Some of you might be aware of the role of Youth Commissioners across the West Midlands. It's a scheme that I operate as Police and Crime Commissioner. Youth Commissioners are elected by their peers, so I do not select them, I do not appoint them. They have to get elected by other young people across the 7 local policing areas, and we have 16 Youth Commissioners in total, and they serve for 2 years, and they have a number of responsibilities and functions. So they obviously represent young people. They advise me as the Police and Crime Commissioner. They help to hold West Midlands Police to account with me, and they also have an opportunity of gaining experience and insight into policing in a very unique way. We're also establishing a youth assembly under the auspices of the Violence Reduction Partnership to engage and work with young people. And these are young people with particular experience of crime, violence, trauma, exclusion, and gangs themselves, so that they can provide an insight into their own experience. And so we can utilise that for the purpose of the work of the Violence Reduction Partnership. And we're going to be launching that youth assembly and establishing a clear role for the youth assembly members. And they're going to have a really important role in terms of preparing a positive counter-narrative for young people in the West Midlands. Want to provide you with some background in connection with progress relating to youth violence and knife crime. Many of you might well be aware that we launched the Community Initiative to Reduce Violence in Coventry and Wolverhampton last year. That was launched in May 2023. It'll run to August 2025. There's £1 million worth of investment going into Coventry, £1 million worth of investment going into Wolverhampton. And the premise behind the Community Initiative to Reduce Violence is that it provides an opportunity to work with young people who have been involved in or are on the cusp of being involved in gang-related activity. So it provides them with the opportunity of engagement and support. And if they're prepared to accept that offer, then they will get help with mentoring and jobs and training and support around housing and mental health and opportunities to get into work. If they don't accept that, then they will be facing disruption and enforcement. It's a scheme that has been operated in other parts of the country from time to time, in other parts of the world, and has had quite some significant successes in terms of reducing gang-related violence in particular. It's going to be academically evaluated, and in Coventry, year to date, we've seen about 49% decrease in knife crime in Coventry since the project went live. It's very early days, and I'm not remotely complacent, but that is obviously a very promising development in terms of the impact that that's having at this point in time. Also, just draw people's attention to the virtual reality headsets project that is running across the West Midlands as well. That's part of the education work we do in schools. That includes the Mentors in Violence Prevention and the Precious Lives programme that we operate in schools. That's been delivered to about 70,000 or more young people across the West Midlands. And the Virtual Reality Headsets project works with 10 to 14-year-olds, and it's been delivered to over 4,000 young people and 358 professionals across the West Midlands whilst it's been operating. People will also be aware, I suspect, of my Helping Communities Fund, which is proceeds of crime that I make available for local community projects to bid into, particularly around those community projects who are engaged in reductions in crime prevention and crime disorder. And we open bidding biannually in connection with that. I've made another £166,000 worth of proceeds of crime available. That was open to applications between the 4th and the 29th of December. and people are able to bid in for small grants up to £5,000 for local projects to prevent crime. And we had a total of 121 applications across the West Midlands for that funding. And important to understand that the decisions on allocation are made by a community panel, not by myself or by my office. So important to understand that. And then finally, just give you a brief report in connection with the ASB hotspot policing pilot areas. West Midlands Police, well, rather the West Midlands was successful in becoming one of the 10 areas across the country to operate the ASB hotspot policing. That allowed us to access £1 million worth of investment in 23-24. We've also got the opportunity to utilise an additional £1 million worth of investment in the next financial year as well. And the idea behind the ASB hotspots policing pilot is to provide a visible presence in the community. We launched it on the 12th of July in double quick time. We had a very short turnaround time scale available to us in order to make sure we put in place the structures necessary in order to utilise this investment. And we worked very closely with the 7 community safety partnerships across the West Midlands, because we took the view that they were better placed and better understood the areas that this investment needed to be focused on than I or my office would understand. And that's as a consequence of that investment, we've been able to put PCSOs and police officers, youth workers, and local authority wardens into dedicated policing patrols across the West Midlands. I think we have about 26 across the 7 local policing areas, and we're collecting significant amount of data in terms of the impact that that's having. We also utilised the funding available to buy some additional ASB off-road bikes as well, in order to be able to deal with the off-road biking, which I know is a big issue in some areas of the West Midlands. So we now have a total of 6 off-road bikes that West Midlands Police have, and we've been able to increase the number of officers trained to use those up to 12 as well. And the total number of patrols that have been conducted in the West Midlands since the launch on the 12th of July up until November is over 4,827, and you can see from the report the tabular breakdown that's been provided there in some detail, and we'll be continuing to monitor that work. There's also the possibility of us being able to benefit from the immediate justice pilot funding as well, which is going to be rolled out next year. So that's my Police and Crime Commissioner update, Chair.
Thank you for the update. That's a quite informative paper I found of the work that you are doing, carrying out, and very useful to know. Just ask the panel to note the update. Okay. Oh, go on, Councillor Gareth.
Thank you, Chair. It was just one brief question, because I appreciate the Commissioner's spoken at length about his report already. It's just in relation to the transition of PCC powers, and I'm slightly surprised you're so vociferous in opposing this, since you tried to become the Labour candidate for the mayoralty yourself. I understand you came last in that contest, but I could be wrong on that. But I just want to clarify, because it talks about here that you're wanting to do a judicial review. Who's going to pick up the bill for that, given all the concerns you've raised around the funding for West Midlands Police anyway? Surely the funding available to West Midlands Police is better spent, and your office is better spent on tackling crime and frontline policing and not taking the government to court.
There's a significant amount of public funds being spent on this transfer. Are you as concerned about that as you are about any public funds that might be attributed to any challenge, in order to hold the Home Secretary and the Mayor to account to make sure that they act in accordance with the law?
Councillor Samantha Getton. Okay.
Thank you. Good afternoon, Commissioner. I think, I'm sorry, but I do have to agree with Councillor Moore that any funds spent, it needs to be on improvements, and that's what will happen if our Mayor Andy Street actually takes the role of the PCC. I can only see that improvements will happen. You talked about what the members of the public want. You've gone through the report, and actually what our public want is a police service that's actually providing a service that's good And at the moment, we've got one that's inadequate and requires improvement, and a police service that, since you've been in post, has actually got worse over that period of time. So, you know, you say about our Mayor Andy Street that it's not a legal move for him to take the role. However, in areas such as Greater Manchester and West Yorkshire, their mayor already has the role of the PCC. So it's really just to be noted that what the members want is a police force that works and that actually does what it needs to do. And currently it's not doing that.
I think it's very trusting of you to express the view that you believe that the mayor will improve policing in the event that he takes on policing governance, bearing in mind that he has so far chosen not to share his actual plan for doing that with any of us, to the best of my knowledge. So I have no understanding of what evidence base you could possibly have for the assertion that the mayor will be able to improve policing in the West Midlands when he has not yet even shared with any of us or the members of the public exactly what that will look like. So I have to say, it's not credible for you to take that view when you don't even know what his plan to allegedly improve policing will be. And I know doubtless that, Councillor, you, I do not doubt, have probably been campaigning vociferously over the last 13 years in order to oppose the cuts that the Conservative government imposed on policing over the last 13 years. I think that was a big mistake. I think it was counterproductive, and I think it was a false economy. And I would also add, not only does that principle apply in relation to the cuts that were imposed on policing, it also applies in relation to the cuts that were imposed on essential preventative public services and indeed our wider criminal justice system. And I don't doubt that you have been vigorously and vociferously been opposing those for the last 13 years and campaigning with a degree of passion in order to ensure that that never happened. I don't doubt that that's been the case, because obviously it's important that we are consistent with these things, and it's not only necessary to will the objectives, it's necessary to will the means as well. And if one doesn't do that and isn't prepared to do that, then of course I don't think the argument is as compelling as it might otherwise be.
Okay, thank you. To Sam Forsyth and then Edward quickly. We have to move.
Thank you, Chair. First of all, can I thank the Police Commissioner for the introduction of the off-road bikes. They have made a significant difference in reducing antisocial behaviour in the Woodgate Valley area of Birmingham, which my ward, Quinton, forms part of. It's something we campaigned for, and thank you for listening. They are making a difference. And secondly, can I just gently remind everybody that no one is above the rule of law, and that includes the Home Secretary. The Home Secretary has now been forced to put out the plans for taking over the Police and Crime Commission to consultation. Any first-year law student will tell you that the rules of national justice demand that there is a consultation before any such change, because as we all know, the Police and Crime Commissioner was democratically elected by the people of the West Midlands. Like it or not, the West Midlands voted for him. And the Home Secretary, when she agreed the proposals put forward by Andy Street, our mayor, overlooked that, and she is now, well, she, who is it today, has now been forced into a humiliating climb down. So everybody has to go through that process. And perhaps we can all remember that, because the people of the West Midlands had a voice, they voted, and to disregard that is something that people disregard at their peril. It sets a very, very bad precedent.
Okay, thank you. Ed, quickly.
Yeah, thanks. Quick question. You mentioned helping community fund in your report there, and I assume Street Watch is a recipient of that, possibly. Anyway, my question is about Street Watch and the banning of elected members being allowed to be a part of Street Watch. I just wonder what your thoughts on that were. A lot of these groups are led by elected members of all political persuasions, and I don't really see where that decision come from, and that it's very helpful.
I don't think that street watch groups are usually, I can double check this for you, but I don't think they're usually eligible for applying to the Helping Communities Fund, because they're helped and supported separately, usually by West Midlands Police. But I'm not aware of what you say in relation to elected representatives being banned from participating in Street Watch. I don't know if anybody has any further information about that. That's not something I was aware of, I don't think, Councillor.
I can show you the letter from the Chief Superintendent of Dudley that's been sent to one of our members, which now says that Street Watch are not allowing any elected officials to be members. Thank you.
By all means, share that with me. I'm not sure I was aware of that particular development or the reasons why that decision was taken. Presumably, some of that is explained in the letter, perhaps.
Okay, we'll take that away and look at it. Okay, come back. Well, thank you for the update. It's been very interesting. And we'll move on to the next panel now, not the next agenda item, which is the work programme. And our next meeting is on the 5th of February, where we will be looking at the proposed precept by the Commissioner, and also the 4 areas of concern that the Inspectorate brought up, that we looked at in December. So we need to start planning for the 18th of March agenda. If there's any topics that members would like to suggest, please propose or send emails in. We can take those on. If you haven't got anything at the moment, you want to think about it, yeah, in the next week or so. And I'm also suggesting that I, with Sarah, look at the PCC plan and see which areas we have not covered in scrutiny, and see if we want to cover any of those outstanding areas as well, just to make sure that we are looking all of the areas of the PCC plan. So we'll have a look at that as well and be in touch with the panel. Okay, so I don't have any urgent business to announce. Nothing's been said. So I'd like to thank everyone for their contributions and participation. It's been quite challenging, and we sort of look forward to meeting each other at the next meeting on the 5th of February. Thank you, everyone. So, you close the stream now as well? Okay.